All right, so good morning once again. We're going to continue from where we ended from yesterday. Now, like I said, I noticed that yesterday's video, that is history taking part three, I noticed that there was no volume towards the end, starting from the part where we started talking about drug history. So I think I'm going to look at that part. So in today's lesson, basically, so remember, we're still looking at history taking. Okay. So in today's lesson, basically, we're going to look at one, drug history. Then two, we're going to look at family history. Then number three, we'll look at social and economic history. Okay. Social and economic history. Then from there, like I've mentioned, I'll not dive into looking at like the pediatric history. Okay, that is the BIND part. All right, and the OBS and GYN history. I'll not dive into this because I think I'll look at this separately when teaching the those that are doing pediatrics, and then look at this one when teaching those that are doing obs and gyne as their first rotation. So that's what we're going to do. Then, if time allows, We're going to look at maybe just an introduction to respiratory system history taking. Okay, just an introduction. Okay, so that's what we're going to do for today. All right, so I'm going to make this as one video. This is going to be the first video, and then this is going to be the second video. So I don't want the videos to be too long, like I mentioned already. If they're too long, it becomes even boring for someone to follow through, and as they are trying to revise and everything. So I want to make sure that the videos are as short as possible. So let's look at drug history again. So, the reason why we look at drug history, number one, okay, so the reasons for looking at drug history, number one, we want to look at compliance, okay, compliance of patients to what? To medication, okay. So remember, we mentioned in past medical history that patients are going to come with some already existing conditions such as hypertension, HIV, diabetes, and so on and so forth, and they are already on what? Medication. Okay. Now you need to know whether they are compliant to medication or they are not compliant. For example, a patient with hypertension, okay, and is not compliant to medication. After you do your drug history, you find that the patient is not compliant to medication. Okay, they're not taking the medication as prescribed by their doctor. And then you see features of heart failure. Okay, so the fact that they're not compliant to medication and this patient is hypertensive, you check their BP, the BP is high, okay, and they're having features of heart failure. That is going to give you a clue that most likely what is causing this heart failure is hypertension because the patient is not compliant to medication. Okay, that is an example. Another example that we can look at is, for example, in a patient with, let's say, HIV and AIDS, okay? And then they present with, let's say, features of TB, tuberculosis. We know that tuberculosis is more prevalent in patients that are HIV positive, okay? So you try to find out, you find that this patient is not compliant to medication, okay, to antiretroviral drugs. So you're going to tell that most likely the reason why this patient has developed TB is because they're not compliant to medication. So we want to know the compliance, okay? And if the compliance is poor, what are some of the complications? What may arise because of poor compliance? Okay. The other reason why we want to look at drug history is sometimes patients may may be taking drugs that are not even prescribed to them by the health practitioners or rather by their doctors. Okay, so it's also to give you a clue of some of the pre-existing conditions. Let me give an example. Okay, an example. If let's say as you are taking your past medical history, all right, and then this patient does not reveal something to you, does not tell you, for example, that they are taking, I mean, they are HIV positive, or maybe it slipped off as you are taking the history. And then when you come to drug history, and then you are told that this patient is actually on ARVs, okay? That is obviously going to tell you that, oh, actually, maybe there's something that we missed in the past medical history, right? And then you include that in your past medical history, okay? So now what do you want to ask? You need to ask the current, okay, current and the previous medications, okay? So has the patient been on any previous medications, maybe in the last 1 week, the last 1 month or 2 months or so, okay? Has the patient been on any medications, and for what reasons, okay? What medications were they on and for what reasons, okay? So you need to know the dosage, okay? The dosage of the drugs. So you know the name of the drug, okay, the name of the drug, the dose, and obviously even the compliance and so on, okay. Then other than that, sometimes the patient may not be able to tell the exact name of the drug, okay. Such things happen, especially with the fact that drugs, the names of drugs are a bit complicated sometimes to remember and so on. So even that patients may not always be able to remember the name of the drug, but at least they can tell you the condition for which they were given that drug, or they can describe the what? The drug. Maybe the whether it's a tablet, okay, whether they are capsules, whether they are maybe it's injectables, okay, or maybe syrup and so on and so forth. Okay, if it's a tablet, what's the size of the tablets? What is the color of the tablets, or even the capsules? What is the color and so on? Okay, you can also ask at what time they take the drug. If they say that maybe they take in the morning, or maybe they take twice in a day, or 3 times in a day, and so on. So you can ask questions that can help you be able to arrive at the name of the drug. Okay, you can ask such questions. Then the other thing that you want to ask also about drug history is allergies. Okay, allergies to medication. Okay, allergies to medication. So some patients may be allergic to certain medications. The commonest example that I can give is aspirin. Okay, aspirin, most patients they complain of after they take, they can develop, or rather they do develop what? Gastric ulcers, isn't it? They do develop gastric ulcers. Okay, so you don't want to give a patient, especially who already has gastric ulcers, you give that patient what? Aspirin. Then you're going to cause more damage to the patient. Okay. Other than that, some another drug is Septrin. Okay. Some patients develop a rash and so on and so forth. Okay. Then other allergies to things like food, okay, dust, pollen, okay. So a patient says that I'm allergic to pollen, okay, or I'm allergic to dust. So you may start thinking of things like asthma, in case maybe it did not come out in, maybe the patient didn't mention in past medical history. They didn't mention that they have asthma, okay, or even things like weather changes and so on, okay. So those are some of the things that you may need to ask rather concerning drug history. Okay, is there any question from anyone so far on drug history? Any question? Okay, so the other thing that I haven't mentioned, and I think yesterday I mentioned, under drug history is history of use of herbal medication. Okay, especially in our setup, this is very, very, very common. Very common. Use of herbal medication is very common. Okay, now uh, the reason why people tend to use herbal medicines is one, because of chronicity of the condition. All right. Maybe the condition has been there for so long and they have tried everything possible. They have taken medications and so on, and the patient just feels like it's not helping at all. Then they opt to go to a witch doctor or a traditional healer or a herbalist and so on, and then they get herbal medication. Okay. Now, uh, the other reason why the people usually do that is because of just their beliefs. Okay, maybe they're just their beliefs or culture. Okay, it may be because part of their cultural practices or just their beliefs or because of the chronicity of the condition, and they decide to go for herbal medication. Okay, now what is the problem with herbal medication? Number one, the problem with that is there's risk of poisoning. Okay, let's say for example in a case of overdose, right? The problem with herbal medication is that it's not easy for you to quantify. You cannot easily quantify. Okay, even if they say, okay, you take a cup of this particular drug. Okay, maybe you, for example, if it's some sort of leaves or whatever, you boil the leaves and so on. But you cannot really tell the concentration. In as much as you've taken the correct volume of the drug that you're given, you take the correct volume, but you don't know the concentration of a particular drug. So you find that maybe you take the correct volume but a higher concentration, means that you have overdosed yourself. Okay, and that can bring about poisoning. The other reason why this is dangerous is because it also predisposes to infections. Okay, they are predisposed to infections. For example, those drugs that where they make sort of tattoos, eh? Okay, they make tattoos and so on, and then uh, they use those herbal medications. So the risk of infection is quite high. Okay, like HIVs, the spread of HIV, and so on. So those things need to also come out. Okay. So you need to know the what herbal medication are they taking and for what reasons. Okay, do they have any condition that they are taking those that herbal medication for? Okay, so I guess unless if there's anything more or rather if there's any question concerning drug history, otherwise we can move on to look at family history. Okay, so family history. Now, why should we take family history? Okay, sometimes it's funny how like in a clinical setup, if you're in a hospital and then a patient comes. Okay, a patient comes and then you're asking them all these questions. All right, you're asking them all these questions, and then the patient will be surprised. Why not just treat what is there? Okay, but you need to know that you need to treat the patient in a holistic kind of manner. Okay, you need to know why, what is the origin, where is the condition coming from, what is the reason, why does the patient have what they have, the condition that they're having currently. Okay, so it's very, very important. So we need to know that some of the conditions that the patient may present with may be conditions that run in the family. Okay, so conditions that run in the family, for example, those are let's say like chromosomal, okay, chromosomal, um, chromosomal disorders, genetic disorders, okay, and so on. All right. Now, some of these that will be right in the family, okay, and you find that some of them are those that are found especially in first degree relatives. First degree relatives may be at higher risk of developing certain conditions. If, let's say, for example, the mother to the patient had hypertension, okay, or maybe the father, or maybe even the grandfather or grandmother, okay, there are quite high chances that the patient may also have hypertension, okay. So uh, here we are doing this to look for the risk factors, okay, risk factors related to family, okay. Now, what are we looking for? We're looking for chronic illnesses, okay, chronic illnesses such as, remember, like in the past medical history, we looked at diabetes, let's say epilepsy, okay. We looked at asthma, okay. Then we also have TB, hypertension, okay, and sickle cell disease, okay. So these conditions tend to run in what? In families, okay. These conditions tend to run in families. So we need to look out for any of these, especially in close relatives to the patient, okay. Then basically, that's what we look out for under family history. Okay, under family history. Then let's look at social and economic history. Now, the reason why we're looking for why we want to take a social history of the patient, okay, and the economic history of the patient. Number one, under social, we want to look at basically at the risks of them developing or rather acquiring certain conditions. Okay, what is the risk of the patient acquiring certain conditions? Okay, under social history as well, what is the risk of them acquiring certain conditions? And for example, those from low socioeconomic backgrounds, okay, you find that the family is large, maybe there are 10 of them at home, and they are living, the 10 of them, in a one-bedroom house, or maybe yes, one-bedroom house without proper ventilation, and maybe one of the patients is even has TB, then you find that the risk of that TB spreading is very high, especially at this time when there's even COVID-19. Okay, we find that if there's overcrowding like that, then the risk of that infection spreading to all family members is quite high. Okay, so we've seen that certain conditions are more prevalent in lower socioeconomic backgrounds. Okay, they are more prevalent in such backgrounds. Even conditions like TB, certain diarrheal diseases, okay, especially the waterborne diseases. Okay, so you need to look out for all those things and see. Maybe the patient presented, like in yesterday's case, the patient presented with vomiting. Maybe there's also diarrhea and abdominal pain. Okay, so you need to look out for these things, the socio-economic status. Okay, what kind of water do they drink? Do they boil the water? Do they chlorinate water? Okay, is the water from a tap, or is it, okay, and so on, all right, or is it maybe from a stream, and so on and so forth. Okay, and if the water is, let's say, maybe from a well, how far is the well from the pit latrine, if they use a pit latrine? So you also ask about it, the kind of toilet that they use. It's fine, I'm telling you, in a clinical setup, you start asking the patient, okay, especially in children, where do you live? What kind of house do you live in? Okay. Um, what kind of toilet do you use? Is it flushable or it's a pit latrine? What kind of water do you drink or use for cooking? Is it from a tap or it's from a well? They say it's from a well, and they also said that they use a pit latrine. So from public, that those two, they need to be far away from each other, isn't it? They need to be far away from each other, okay? And so that there is a reduced risk of cross contamination between things from the pit latrine going into the well. Okay, so you need to look out for all those things. So now let's look at so for example, some of the things that you can ask is, um, who do you live with? Okay, who do you live with? Okay, so here basically you are trying to look at the family, okay, of the patient, who they live with, the people that they live with at home, okay. And if the patient is old, okay, you asked about marital status from what? So you can now go to things such as sexual history, okay, sexual history. So here you can ask about regular sexual partner, okay, regular sexual partner. So if the patient mentions that they don't have a regular sexual partner and yet they are almost always having sex, then it means that this patient is at high risk of developing what? Or rather acquiring sexually transmitted what? Infections, right? And then, do they use protection anyway? Okay, do they use protection? Or in females, barrier contraceptives, okay, contraceptives, okay, do they use that? Then you can also ask the the gender, okay, the gender of their sexual partner. You don't have to assume these things, okay. What is the gender of the sexual partner? I remember, it should be some months ago, we came across a patient who had a male patient who had anal warts. Okay, you know what warts? Warts are usually common. It's like when you look at vaginal warts. Okay, now this patient is a male patient, had anal warts. So when we saw that, but it implies that this patient most likely is homosexual. Okay, the male patient is homosexual, meaning that he has sexual intercourse with a fellow male. Okay, so you need to ask about the gender of their sexual partner. Is it homosexual or is it heterosexual? Okay, we know that normally it's heterosexual, male and female, but it still happens that we have male and male or female and female. So you need to ask about such things. Obviously, patients, it's going to be weird when you ask such questions. Okay, but you still need to ask. All right. Then you can also ask uh, about alcohol. Okay, you need to ask about alcohol. So here you need to find out the quality and the quantity. Okay, the quality and quantity of alcohol. All right. So on alcohol, okay, you need to know the quality and quantity. Okay. So in other words, you need to know what alcohol. Okay, what alcohol do they take? Okay, and then you also need to know how much of the alcohol. For example, why is it important to know the type of alcohol and the quantity? Okay, so you know that there are certain alcohols that are more concentrated than the other, such that one who takes a glass of the more concentrated alcohol is the same as one who takes 10 of a lesser concentrated alcohol. Okay, so you see that you find that they are almost the same. Like I remember, is it some years back when the Zambian government banned the manufacture and distribution of this type of alcohol. We used to call them locally called tujiri. If you remember those. So the reason why those were banned was because they were very highly concentrated and they were cheap, such that a lot of youths would actually, even those that are not employed, would easily manage to buy those highly concentrated. They were very small sachets, very small sachets. I think one sachet would just be about. I think it never even used to go up to 100 mils. Okay, I don't think it used to go up to that. Maybe just about 50 mils or so. Okay, but you find that it was very concentrated, and one who takes maybe about 5 of those, they would actually even black out. Okay, so the government banned the manufacture and distribution of those types of alcohol. Okay, then you also need to know how often they take the alcohol. All right. So you don't just need to know whether they take alcohol or they don't take. Okay. If they say they take, you ask further, what alcohol do they usually take? Okay. And how much of it and how often do they take? Okay. There are those that are going to say that, oh, actually, I do take alcohol, but I only take alcohol on probably special events. There are those that will say, I only take on Christmas Day, on New Year's Day, and so on and so forth. Okay. But still, you need to know what alcohol do they really take. Okay. You still need to know that. Then, same with smoking. Same with what? Smoking. Okay. You need to also qualify and quantify the smoking. What cigarettes or cigars or pipes? Okay. Do they take cigarettes or is it cigars or is it pipes that they take? How much of it? How often do they take? Okay. So you need to know those things. Then you look at occupation. You look at occupation. So occupation, you need to know what type of work they do. Okay, the reason you need to know about occupation and rather the type of work that they do is because of the risk of some conditions. Okay, occupational related what conditions. For example, a patient comes, all right, obese, and probably the patient has diabetes and maybe hypertension. Okay, and then they say that the work that I do usually involves me sitting. Okay, there is less physical activity. All right, that is going to explain why the patient is having the condition that they are having. Okay, so the risk of non-communicable diseases is higher in patients that live a sedentary life, a life with lower physical activity, with less physical activity. It's very high. The risk of non-communicable diseases, lung diseases, and so on. Okay, so there's a risk of that. The other reason why we are asking about occupation is we want to assess the economic status. Okay, the economic what? Status. Okay, the economic status. I think that there's something. Let me finish on social history. Then I'll mention. I think there's something I forgot to mention on family history. Okay, so we also want to assess the economic status, and if someone tells you that, oh, I'm an accountant or I'm a doctor, or they say those higher paying jobs, then you'll be able to know that, okay, at least this patient is able to manage some of this. If you want to order for certain investigations, if you want to prescribe certain drugs that will require them to buy and so on, you'll be able to know that they are able to afford or manage the what is required. Okay, so as I conclude, I think there's something that I didn't mention about family history. Okay, about family history, you need to know if the parents, okay, about parents of the patient, are they both alive or one or both of them are late, okay, and you need to know if they are late, okay, if they are dead, you need to know the cause of death. Okay, you need to know the cause of death. What caused the death of one or both parents? Why do you want to know that? Is because what might have caused the death of one of or both parents may be what has even brought the patient to the hospital. Okay, for example, if the